clearly there is value for repetitive nerve stimulation and jitter analysis to follow up a patient. So what kind of standardization do we need to implement if we want to compare the results on serial studies?
Well, if I take the one on repetitive nerve stimulation, you can really see changes from day to day in patients that in earlier days had alternate day prednisolone treatment. They said that were better and worse, and that can be seen in RepStim, provided we had a real standardized situation. And now I come to answer your question. For repetitive nerve stimulation, the patient need to be resting for at least 15 minutes. It's a great difference if they are not resting or if they have been coming in the stairs of the hospital, for example. The other thing is temperature control. The improvement with, or the reduction in decrement with a cold hand compared to when it's warm. So temperature control is one important thing. And the other thing is certainly the treatment, the drug the patient has been taking, and maybe Tom can make a little more on drugs regarding also single fiber.
It is important that the measurements be made at a consistent time after doses of, for example, cholinesterase inhibitors. And that's true not only for repetitive stimulation and single fiber EMG, but it's obviously important also for the clinical evaluation. As a part of the standardization, you have to determine the minimal amount of time that patients should be off their medications. In many circumstances, that's determined by the clinical status of the patient. If it's safe to do so, we ask our patients to withhold their medication for at least 12 hours before electrodiagnostic studies are performed. In patients who would not be able to withhold their medications for such a period of time, I don't know that it makes that much difference, because these patients have such severe weakness anyway that I doubt there'd be that much difference. So if they can safely withhold medications, we ask them to do it for at least 12 hours.
And is that for repetitive nerve stimulation as well as single fiber, or can you continue medication if you're going to do single fiber EMG?
That would be for both single fiber EMG and repetitive stimulation.
Patients in Slovenia rarely come on mestinon, to the single fiber EMG study. So this is not a big issue at all. But when we do some follow-up, then we ask them to be off medication for 12 hours.